How to make your vagina tight. Well, do these things to make your vagina tight. Number one, put cloves. Boil put cloves, ginger, garlic, scent leaf, boil them together, put it in a bath and sit on it. Sit directly on it so that the heat will go inside. Number two, use alum. Put alum inside water and melt it. Then use the water to be washing your vagina. Number three, soak cloves for 3 days and use it to be washing your vagina every day, morning and night. If you do this the first time, if it pains you, it means that you have infection. If it does not pain you, you're okay. So if it pains you, continue to be washing it until it stops paining you. Number three, use Maggi. You can put your Maggi inside that place. It will make it tight. Number four, you can do vaginal steaming by doing hot water, putting hot water, very hot water, then put salt inside and put scent leaf. Especially if after your menses, it will make that place, it will cure infection for you and it will make you very tight. So these are the things I saw on Facebook yesterday when a young mother asked of how to how to tighten her vagina because she just gave birth. And these are the series of things that I saw people telling this young woman. Now, it's possible to give birth and your vagina is flabby and it's open and all of those things. There are many things to do. In fact, if you want to become a virgin, there are things you can do to become a virgin if you want. Very safe and very easy. But these things I just mentioned, on no account should you try it. Do not try these things that I just said. It will harm you. It will make you not wet. It will cause recurring infection for you. You will see yourself having treating infection almost every month. Now, if you do, of course, when you sit on hot water, hot water has this soothing feeling. You will feel you are better. But trust me, you will be treating infection often and often. These things, what they do is they go inside your vagina and kill the normal flora. Now, they kill these good microorganisms that are supposed to protect your vagina. They kill it. It is not good for your vaginal health. It is not good for your health. There are ways you can use cloths to get wet, but putting it inside your vagina and washing it inside your vagina is not one of them. Don't worry, I'll tell you all of these things, okay? At any point you stop watching, you can just finish the video on my YouTube page. Now, because of the time frame, obviously. Now, these are the things to do, the medical things to do, very safe to make you tight. This thing is an exercise that you can do. It does not involve money or anything. It is called kegals. Kegel exercise called kegals. I am teaching you right here how to do kegals. But first of all, when your husband is about entering, try with the help of these kegels. After teaching you how to do these kegels, it will make you master the act of constricting your vagina. So when he's entering, don't always be flaccid. Let him try to hold yourself. Let him feel that tightness as he's entering. And when you become wet, it becomes worse. Okay, but try to hold yourself. You can't do this if you don't master the art of these kegels, because these kegels will strengthen your pelvic walls. Okay, so you will not know how to do this until you learn kegels, which I'm going to teach you now. Now, for the women that always have cuts during childbirth, during childbirth, this is what you should stop doing. This is what you should do for women that have cuts for tear. Now, women tell their midwives they don't want a cut, they don't want an episiotomy. Now, episiotomy is quite different from tear. Tear is usually the women will say no, they don't want episiotomy, they will they can bear the child. They will now be pushing, and the force of the baby will exert, the pressure will exert on the vaginal walls, and tear will happen anyhow. You can go like this, the vagina will just be jagged. But an episiotomy is the one that your midwife will give you, she will give you, and it will be very clean. After delivery, she will suture you back. It will still go back to the way it is. But when you allow yourself thinking you can do it, you have a tear, the vagina can become anyhow. So please, this is very important. Allow your midwife to do her job. Okay, cut is not a problem. It heals. Okay, I'm sorry. So let's get to it now. Vaginal steaming. This is the way to do vaginal steaming. Vaginal steaming is not done with hot water. Steaming is done with warm water. And you put it, people that have given birth, I know you say that your doctor told you to do it, but your doctor has told you to do vaginal steaming. Yeah, this is how to do it. You put it's warm water, not hot water. Okay, you don't sit on hot water. That hotness will, give you burns around your vagina. You might not see it, but it happens. Okay, so it's warm water that you do it. Even people that have hemorrhoids, they do vaginal, it's called sitz bath. It's not with hot water. Okay, now how to do Kegel exercise. Kegel exercise is done this way. When you want to go by constricting your pelvic muscles, right? How do you locate your pelvic muscles? When you go to urinate, that force is as if just try to hold yourself as you pee. Try to hold yourself. You hold the urine, then release again, then hold it, then release again. That's how to locate your pelvic muscles. So you can do this like 10 times for 30 times in a 30 times for maybe like 10 times in a day, as long as you remember. But you must not be in the toilet when you're doing this. Okay, can do it because the toilet is an easy way to locate it. Okay, so in fact, the first time you want to do it, you will see that you find it difficult to do it because you will see that your urine will do as if it's seeping out. It's seeping. You can't hold yourself because your muscles are flaccid. Okay, so when you have mastered the art of holding yourself, okay, when you now go to urine, when you stay on your own, sometimes you just hold yourself. There are some exercises in the gym, okay, that core exercises. I'll do that on another video, but this one is the most important one. Hold yourself. Remember, now when you master this art, when your husband is coming in, you try to hold yourself. Okay, now that's one that if you want to become a virgin, you do a surgery called vaginoplasty. This surgery is very easy. Is your doctor, that your gynecologist, that doctor that this CS can do it for you. In fact, you tell your doctor to do it during childbirth and everything, they can still do it. Okay, it is not expensive. These are what people are doing. If you want him to make you a virgin, he can make you a virgin. Very easy. All those people that maybe you gave birth to so many children, your vagina has become so flabby, excess skin, they will cut it around, suture it from inside out. It will become okay to the length of your husband's manhood. Okay, and this is what women are doing. This is what women are doing. You hold your marriage, you become not about your marriage, you become confident about yourself, because childbirth does a lot of things for women. Okay, so these are things to do. It's very safe, it's easy. In fact, the CS is more painful. You can do it today, go the next day. Okay, that is it. So don't put all of these things will harm you. Don't put it. Now I'm going to tell you how to be wet. I've already explained to us why causes of vaginal dryness, so you will know what is causing your own vaginal dryness. So when I do how to get wet, if you're not in the category of those things that causes it, because you will not go and do the things I ask you to do when you have a medical condition already. Treat your medical condition. But if you don't have a medical condition, these things will help you. And I'm going to teach you the right way to use cloves. Cloves will make you wet, but it is not what they are saying that will make you wet. In fact, there are some people that shouldn't be taking cloves. Okay, so, and it's not by cooking, and there's another video. Like this video, share, let me know if you have questions and your opinion. Make sure you subscribe, please.